If you're over 70 and your doctor recently congratulated you for bringing your blood pressure down to 120 over 80, you may want to pause for a moment and listen carefully. For decades, we've heard the same message repeated everywhere. The lower your blood pressure, the healthier you'll be. Doctors, television programs, and health articles have reinforced this idea so often that many people believe there is only one perfect number. But in recent years, researchers studying older adults have started noticing something unexpected. When thousands of seniors were followed over several years, some studies suggested that people with what doctors call perfect blood pressure sometimes experienced more dizziness, more falls, and in some cases worse overall outcomes than those whose numbers were slightly higher. This doesn't mean high blood pressure is safe. It certainly isn't. But it may mean that the ideal blood pressure range for someone in their 70s or 80s may not always be the same as the target used for someone in their 40s or 50s. Understanding this difference can make a big impact on safety, independence, and overall well-being as we age. Imagine a situation that happens in clinics every day. A 78-year-old walks into a routine checkup. They feel reasonably well. Life is moving along normally, with perhaps the usual aches and stiffness that come with age. The nurse wraps a cuff around their arm and checks their blood pressure. The screen shows 145 over 86. According to many traditional guidelines, that number is a bit higher than ideal. The goal is often to bring the top number below 130, sometimes even closer to 120. So the doctor prescribes a medication. 2 months later, the patient returns for another appointment. The medication is working, their blood pressure is now 132 over 80. Everyone feels encouraged, the numbers are improving. A few weeks later, another adjustment is made, just to bring the numbers down a little more. At the next visit, the reading is 124 over 78. On paper, everything looks excellent. But outside the clinic, something small begins to change. One evening, the person stands up from the couch to answer the phone. For a moment, the room feels slightly unsteady. It passes quickly, so they ignore it. A few days later, they stand up from the dinner table and again feel a brief wave of lightheadedness. Later that night, they get out of bed to walk to the bathroom. As they stand up, the dizziness is stronger. They grab the wall to steady themselves. Within seconds, the feeling fades, but it leaves behind a quiet question. Why did that happen? Many older adults experience moments like this and assume it is simply part of aging. Sometimes it is, but sometimes it has to do with how blood pressure behaves when the body changes position. To understand why this happens, it helps to understand what blood pressure actually does. Blood pressure is the force that pushes blood through your arteries. Every heartbeat sends blood throughout the body, delivering oxygen and nutrients to the brain, muscles, kidneys, and every other organ. The reading has two numbers. The top number, called systolic pressure, measures the force when the heart contracts and pushes blood forward. The bottom number, called diastolic pressure, measures the pressure when the heart relaxes between beats. For many years, the message has been simple. Lower numbers are better. For middle-aged adults, that advice is often correct. Lowering blood pressure in midlife can greatly reduce the risk of heart attacks, strokes, and kidney disease later on. But aging changes the body in ways that make the story more complex. A circulatory system at age 75 is not simply an older version of the one at age 45. It functions differently in several important ways. One of the biggest changes involves the arteries. When people are young, arteries are flexible and elastic. They expand easily when blood flows through them and then return to their normal shape. Over time, those arteries gradually become stiffer. This natural process means the body may require slightly higher pressure to move blood efficiently through the system. If the pressure becomes too low, the brain and other organs may not receive enough blood in certain situations, especially when a person stands up. Another important change involves the body's pressure sensors. Inside the blood vessels are tiny sensors that constantly monitor blood pressure and signal the body to adjust when needed. When a younger person stands up, these sensors react almost instantly. They signal the heart to beat slightly faster and cause blood vessels to tighten just enough to maintain steady circulation. As people age, these sensors can become slower and less sensitive. That delay can allow blood pressure to dip briefly before the body corrects it. A third change involves how the body processes medications. The liver and kidneys are responsible for breaking down and removing medications from the body. With age, these organs often work a little more slowly. That means medications may remain active longer and sometimes produce stronger effects. When blood pressure medication lowers pressure more than intended, the result can be a sudden drop when standing up. When a person stands, gravity pulls blood toward the lower part of the body. Normally, the circulatory system adjusts within seconds, but if blood pressure is already low, or if the body's response is slower, the brain may briefly receive less blood. This condition is often called orthostatic hypotension, which simply means a drop in blood pressure after standing. During those few seconds, a person may feel dizzy, weak, or unsteady. In many cases, the sensation disappears quickly, but even a moment of imbalance can lead to a fall. Falls are one of the most serious health risks for older adults. For younger people, a fall might result in a bruise or a sore muscle. For someone in their 70s or 80s, the consequences can be far more serious. Broken hips, wrist fractures, and head injuries are common results of falls. Recovery can involve surgery, hospital stays, or weeks of rehabilitation. Even after physical recovery, many older adults lose confidence in their balance. They begin moving less and avoiding activities they once enjoyed. Over time, that loss of movement can affect strength, independence, and overall health. This is one reason doctors and researchers pay such close attention to blood pressure levels in older adults. In recent years, studies that followed large groups of seniors over several years began revealing an interesting pattern. Older adults whose systolic blood pressure stayed roughly between 130 and 140 often had some of the best outcomes. Meanwhile, those whose pressure was pushed very low sometimes experienced more dizziness, fainting episodes, and falls. At the other extreme, people with pressure above 150 showed higher risk of strokes and cardiovascular problems. So the safest range for many older adults appeared to sit somewhere in the middle, not extremely low and not extremely high. Another important detail is that blood pressure changes throughout the day. Stress, activity, sleep, and even meals can affect readings. A single measurement taken during a doctor's visit may not reflect what happens during everyday life. This is why many doctors encourage home blood pressure monitoring. Checking blood pressure once in the morning and once in the evening for several days can provide a clearer picture of overall patterns. Writing down the numbers helps track trends over time. There is also a simple check that can help identify whether blood pressure drops when standing. To try it, lie down and rest quietly for about 5 minutes. After resting, measure your blood pressure while still lying down and write down both numbers. Then stand up and measure your blood pressure again immediately. Compare the readings. If the top number drops by more than about 20 points, or the bottom number drops by more than about 10 points, it may suggest that blood pressure is falling significantly when standing. This doesn't provide a diagnosis, but it can be useful information to discuss with a healthcare professional. Another important thing to remember is that two people of the same age can have very different health situations. One 81-year-old might be managing several medical conditions and taking multiple medications. Another 81-year-old might remain physically active and have very few health issues. Even if both people have the exact same blood pressure reading, their treatment plans might look very different. One person may need medication adjustments, while the other might focus more on lifestyle changes. This approach is sometimes described as treating the patient, not just the number. Being aware of how your body feels is also important. If standing up frequently causes dizziness, fatigue, or a moment of unsteadiness, it may be worth mentioning during a medical appointment. Small symptoms sometimes provide clues that numbers alone cannot reveal. Monitoring blood pressure, noticing how the body responds, and discussing those observations with a healthcare professional can lead to safer, more personalized care. Blood pressure remains one of the most important factors affecting long-term health, but the body changes as the years pass, and medical decisions often need to adapt to those changes. For many older adults, maintaining a balanced range that avoids both extremes may provide the best combination of safety and protection. Understanding this balance can help people make informed decisions and have more meaningful conversations with their doctors. This information is intended for general educational purposes only and should not replace professional medical advice. Blood pressure management should always be based on individual health history and guidance from a qualified healthcare professional. Never change medications or treatment plans without consulting your doctor.